Hello, current and future healthcare leaders. Welcome to the Health Admin Life podcast. My name is Brooke, and today I would like to welcome Shanello, Senior Regional Director of Operations for Legacy Community Health. Shanello, can you tell our listeners a little bit more about who you are?
As you mentioned, I'm the Senior Regional Director of Operations for Legacy Community Health. So I've been in healthcare for about 10 years now. Started way back as a Baylor University grad, so Sikkim Bears, where I studied community health, and that really sort of forged my passion for public health. Went on to receive my MBA at Abilene Christian in healthcare administration. And now I'm currently working on my doctorate at the University of Southern California in organizational leadership and change. I'm a mom to a 9-year-old son, which is a lot of fun right now. Everything is one syllable or plural. So it's a very interesting age for us. But he keeps me busy with a lot of baseball and other activities. And so that's usually what you find me doing if I'm not at work or studying.
Wonderful. I love it. Thank you so much for sharing and thank you for being on the show. I think one of our first questions that we have is usually, what does your position entail? If you can tell people a little bit more about what you do, I think a lot of people may have an idea, but if you can go into depth, maybe even like day-to-day duties, that would be fantastic.
So my role is a little bit unique because a portion of my responsibilities are focused on addressing the operations for our senior care service line. So basically, I help run and lead the department as we begin to cultivate and expand and create that service line within our organization. It's very new for us, but we've been able to open 3 clinics in the last 3 years, which is very exciting for us, especially as a federally qualified health center. And then the other side is just focused more so on the overall operations for some of our other key service lines like adult medicine, infectious disease, pediatrics, family practice. So in total, I oversee about 9 clinic locations, which is pretty massive. I've got about 150 direct reports, and so indirect, obviously, that number goes up substantially. But in total, we see about 250,000 patient encounters a year. So really large operation, and that's not even including everything, the other 2 regions that we have within our organization. So my day to day is really just focused primarily on leading the individuals who are doing the work on the grounds, whether that's our front desk team members, our medical assistants, clinicians. We've got directors and operations managers supporting them, and those individuals report up to me. And then on the back end, I'm working with a lot of key stakeholders as well as members of our executive suite to create decisions, create processes, workflows, as well as, sorry about that, as well as um, other gaps and opportunities that we have within our system and how we can expand our work and continue to provide access to the community.
Thank you so much for sharing and love technical difficulties. We've definitely had a fair share of those already, but totally okay. Um, I know something you mentioned is you get to oversee a lot of new construction too. I think I've had a little bit of that on the planning side. I get to do market intelligence. Um, can you tell people a little bit more about what that entails too? Like, I think people don't know like what goes into there's so many different aspects, like what goes into it and leading a group. I think you mentioned you have about 600 direct reports or people that work for you. So that's also an undertaking in itself.
Actually, a portion of my regular getting to see how everything is built, right? You get to see the foundation from the moment that the building starts to be constructed, the walls going up, you're going through the floor plans, the designs of what you want the clinic to look like, what services do we want to offer, what certifications, credentialing, and so forth. And so over time, you just continue to see this small idea that was once on paper now expand into a real building with people staffing inside it, running it, providing access to care. And it's really amazing and such a unique opportunity and something I'm very grateful that I get to experience. And I think it also it gives me an additional side to the healthcare side that we typically don't see, right? Typically, when you're an administrator, you're either in the clinic or you're on the business side with the finance or even IT. And so being involved in the project management that's geared towards the construction and the cultivation of the overall business is really exciting.
That's wonderful. And my next question is, I think you've mentioned this a little bit. Just want to ensure that the sector you're working in, you mentioned that it is healthcare system based or like hospital systems.
Yeah, good question. So we are a community health center, and so we are what the official term would be is a federally qualified health center, also known as an FQHC. And so we are the largest in the state of Texas and one of the top five in the country from a size perspective. And so what that means is we really have the opportunity to provide care for people who don't typically have access to it, which is our mission and something that we feel very strongly about. But, healthcare is a right and that everyone should have access to it. And so with over 60 clinics in the Houston area, as well as Baytown and Beaumont and other surrounding communities, we're really able to provide a lot of care.
Thank you for explaining. I think a lot of people don't know what that means, so I appreciate you elaborating on it a little bit more for the younger generation. I know you mentioned that you've been in this for 10 years now. How did you get into it? What made you want to go into it? I think a lot of people don't know a lot about healthcare administration and the different routes you can take. What led you to where you are today?
Yeah, could have pictured where I would be now. I never would have imagined it, honestly. What I wanted to do looks so different 10 years ago than it does now. I'm in a space now where I'm absolutely knee deep in my career. I love what I'm doing. I'm passionate about it. Even regardless of the challenges and the things that may come with it, I absolutely love it. But I started in the ER at a hospital in Waco. So smaller community. But I learned so much from being in the ER, a lot of medical terminology, just the understanding of the outpatient side and the hospital system. And I think that that's where a lot of my knowledge really started to stem from, especially the medical terminology and really just understanding what's happening on the clinical side. And then I just continued to work in the hospital sector at institutions like MD Anderson, or with organizations like HCA, Hospital Corporations of America. And so working in those bigger corporations gives you additional opportunities to kind of tap into different things. But it wasn't until I entered into this role at Legacy where I think the culmination of everything I've learned the 7 years prior really just helped me excel in the work that I do today. I didn't do any administrative fellowships. I didn't do internships, which is so different because that's such a huge focus right now and for current students and undergrads, and which I love and I think it's great. And so it's been exciting to be able to see my progression move so rapidly, especially at such a young age. Um, but I would say don't come in with a full plan. I didn't. I think just allow the experiences and the things that you learn to kind of help navigate you because it's never going to be what you expected or planned for it to be at all. It's always going to look different, especially since healthcare is ever evolving.
I like to tell people that too. It's not like going into a clinical role, let's say as a physician. That's a one specific role, and there's probably a couple of ways you could go about doing it, but that is the position you want to go into on the healthcare administration route. So many different opportunities, and a lot of people might come in, and I wouldn't say a lot, but people do come in and say, I want to be the hospital CEO, and this is what I want to do. And sometimes you might change your mind, and that's okay. Keeping an open mind, I think, allows you to go a lot of different routes and have a background um, that's different than everybody else. For instance, I know I started out interning. I also worked part-time as a receptionist at urgent cares, then went into the hospital-based system. And I went from undergrad straight to getting my master's. And I've loved my journey, but it's not the one size fits all. You can do anything. And I think from your background, it's a little bit different too. And correct me if I'm wrong, but you're getting your PhD. Remind me one time more time.
Yeah, getting my EDD, so Doctorate of
B.
Education, in organizational change and leadership. And so what that means, it's a mouthful, I know, is that it just gives me the opportunity to really just apply that knowledge and my experience and go into organizations or infrastructures and help them eliminate waste, apply lean concepts, cultivate leaders, and help them navigate people management, change management, project management. So I'm really excited for it. I think of all of my degrees, this is the one that I actually enjoy the most. And I've learned so much from, which is so surprising, but it's been a great experience.
I love to hear it. For my next question, we love to ask, what is your favorite thing about working in healthcare?
Oh, it's a hard one. I think the patients for sure are the first one. Just hearing their stories, especially working in the senior care sector for a lot of my years and having that exposure to older adults, you get to hear so many stories, so many journeys and experiences, meet so many different people. And you don't realize how vast or big the world is until you really just sort of engage in these conversations, or even travel, right? And so when you're starting early off in your career, that may not always be the case. And so being able to kind of travel with these people through their stories has just been so amazing. Um, and then I think the other aspect is just how grand healthcare is. Like compared to other organizations or services, there some of them they kind of fit in a box, right? And so it's just kind of like finance or accounting and that's what you do, which those are all great things and so necessary. But healthcare, there's technology and there's finance and there's just so many different things, like you said earlier, and you have the exposure and the ability to really just tap into that marketing, and um, even Google has their own healthcare sector now. So I think it's just amazing to see how much healthcare administration has just evolved, but healthcare in general.
And even going off of that, Amazon, I think they
Yeah.
have theirs too now. So I
Yeah.
think everyone might be tapping into healthcare. Um, but also there's so many routes. Like I think a healthcare in itself is like its own ecosystem. You need all of the other jobs to make it come to life. So it's so important, but also gives you availability to do so many different things. But at the end of the day, like you said, I think patients are at the center of it. And it makes me that much more passionate to go into it. It's truly meaningful knowing that I could be the next patient and I want to give back. I want to help myself. I also want to help my family and others out there because you're probably going into this earth into the healthcare system and then you're leaving this earth probably at the same way. I know there's different journeys, but I think at one point you're going to touch the healthcare system at any point of your life, even if it is indirectly with another family member or friend, someone you know is going into it. So trying to make it better is so, so rewarding. Yeah, exactly. For the next question, I always wonder because I'm still even going through this. I feel like I'm a young curious myself, but is there any advice that you would give to young leaders going into this or lessons that you've learned along the way?
It's the process. Such a simple statement. And we hear it all the time, but it is so true and so valid. I think, just like you said earlier, you can't ever come into um, this industry with a set plan or a map in mind because it's not going to look the same tomorrow. It's not going to look the same 5 months from now, and definitely not 5 or 10 years from now. So trust this process, whether it's good or bad. I've been laid off twice before unexpectedly. As a mom, that's challenging, and then you're still considered entry level with not a lot of experience, and so you're having to fight harder to prove your value and your worth as a young professional. And so, but all of those experiences, including the layoffs, really have molded who I am as a professional. They've made me that much hungrier. They've made me work that much harder. I've been able to learn things that I may not have learned had I not gone through some of the challenges that I've had to face. And so I see my career growing and evolving because I trusted everything, because I was patient, and I accepted everything that came with it. I wasn't in a hurry to move forward. Which there were times where I was worried when you see your friends who are lawyers and so forth graduating quicker and salaries are much higher. It's intimidating because we have to work a little bit harder, especially since we're non-clinical. But just trusting the process, that's such a huge and important aspect of it.
Thank you for sharing that and being transparent in your journey. I have something similar to where I was forced actually into resigning or leaving an opportunity short. Um, and it wasn't easy, but it made me stronger and it definitely had me reflect a little bit more on my experiences and what I need to grow. I can't put all of the blame on that company. It takes two to tango, essentially. But in general, when it comes to this field, usually if you're coming into it straight out of undergrad or even graduate school, you are going to be younger than a lot of the clinicians that you're working with. And so it's important to have a foundation and understanding of what they're going through day to day, what the actual operations are like, not just with them, but the whole system, all of the players involved. And I think that's what's nice is starting out interning, working part time, volunteering, doing what you can to educate yourself on this because if you just come in thinking you know everything, you're not going to do well. You have to have empathy, you have to have the knowledge base of what they're going through too. And so, going back to passion and patience, you have to be passionate about this because it's not going to be easy. It really isn't, but it is so rewarding, so rewarding in the end. And I think that you can make a bigger impact than you think, which is awesome. Next question we have is one of the harder ones, but I love to ask it. It's if there was one thing you could solve that's either a challenge or an issue that we see today within the healthcare delivery system, what would it be?
Definitely the insurance aspect. There's so much that insurance offers us, and it's so important and so necessary, but it is so heartbreaking seeing the way that patients and their families struggle to navigate it, whether it's just a lack of understanding of the insurance system overall, understanding their benefits, or seeing the cost that they sometimes have to pay, even just to come to a standard office visit, or even just for a physical exam. And so, I wish that there were things that we could do to just make it easier for patients to access their care and access their health. And that's obviously a bigger conversation and that involves a lot more parties, but it should not be so hard for people to get the care that they need to improve their quality of life and just to survive.
I completely agree. I feel like I even struggle even understanding this, the complexity that there is, and I work in it. So how can I expect patients to understand
Yeah.
the insurance side? Is there a solution that I know of in itself? Not necessarily. I think other countries have tried in different models and not their
Mhm.
model isn't always the best either. But I think it is broken. We are working towards it where we're trying to create more transparency laws, but I don't know if we're doing enough.
Mhm.
And it's kind of it feels like it's like I'm stuck. I feel like this is a problem like I even want to solve and I don't know how. I don't know if anyone really truly does, but if you had the opportunity to take a stab at trying to solve something like this, what would be that first step?
Yeah, that's a tough one. I would say the first is really just the patient education aspect. I think a lot of times lack of understanding and awareness is where we run into the healthcare concerns that our country faces on a daily basis. And so if we could do more to really just educate the community about the diseases that they're prevalent to, the diseases that they may be exposed to in the areas that they may live, right? Or even just understanding, hey, how do I contact my insurance and change my provider to a provider that's in network, you know? So for some of us, those things may seem so simple, but for some people, that's really just the difference between life or death for them. And so starting with that education and that awareness is a huge part.
Thank you. I think that's incredibly helpful. And hopefully maybe more hospitals or even on a bigger governmental federal level that we do provide more opportunities and even mandates to educate patients. Um, but one of my last questions I like to ask is more on transparency, as we're on that topic too. And thinking of salaries and going into this industry, is there anything you can say, or even on the negotiation side, any tips to compensation for young leaders?
Yes, I think my first advice would be do your research. Look at the market, look at the individuals who are within the same role, within your area or roles that are very similar, and look at their experience and check where you align in that. I think it's important to recognize your value as an employee and what it is that you have to offer any organization that you're going into, and make sure that you request that, and you'll find that a lot of times organizations are willing to kind of meet you along the way, or get very close to that. You're not always going to get the highest offer at the first offer that they give you. And so you kind of have to do a little bit work to show them, and kind of bring them to the table for those conversations. And I think the other side is a lot of people are uncomfortable with having those conversations when it's time, especially with their recruiters. And it's okay. But I think we need to get more comfortable with having those conversations, right? Your organization is never going to, like I said, come with the highest offer right away. And so it's up to you to go ahead and push that conversation and ask them and talk about it and negotiate the salary that I think best supports you in this role and your lifestyle.
Thank you so much. I think people will love that advice. And on top of that, it's not just about base salary too. I like to tell people that there's
Yeah.
so many things you can negotiate, even if it's outside the range of strictly this is my base salary. But think of PTO, your
Yeah,
time off, think
exactly.
of 401k matching. Think of even health insurance. See if you can push down the rate of premiums. Things like that are so important that people don't think about, or even moving bonuses, retention bonuses, hiring bonuses. There's so many different bonuses you can think of. If you want to go to the route of commission, why not? Um, yes, so I would add on to that too.
Like you said, because I don't think I knew until is where I actually started to learn about those
Mhm.
things. And I was like, oh, so there's more to it out there. So I love that you share that because I really think that's something that a lot of people aren't aware of or even know about.
Agreed. Well, on that note, this has been such a wonderful conversation, and I thank you so much for being a guest speaker on our show.
Yes.
I have a feeling that people would love to stay connected with you. Is there a way that people can stay in touch, whether it's a website, LinkedIn, any social media presence?
Yeah, absolutely. So you can find me on my LinkedIn, Chanelo Newiki, and I'm sure Brooke, you'll spell that out for them. But you can find me on my LinkedIn. That's where you'll probably see often updates about things I'm doing professionally or even personally as it relates to that. And I just started my Instagram, so I'm still building that up. But you can find me there on Instagram as well. So feel free to follow me and help me bring a little bit more volume, and I'll definitely try to be more active on that as well.
Wonderful. Well, on that note, I want to thank everyone for listening today. The show is brought to you by our sponsors, Riverside and Spotify for podcasters. To listen to more episodes, check out the link in my bio at Health Admin Life on TikTok, Instagram, or YouTube.